baby.
Casmay, she's a queen. This is dedicated to all my beautiful queens, all my beautiful ladies out there. She's a queen. Go queen. You got it, girl. She's a queen. You better represent. Go queen. Go queen. Go. She's a queen about her business. Queen. Working hard on a mission. Yeah. Head high, purpose driven. Purpose driven. Crown will never tilted. Queen. Go queen. Go queen. Go queen. Go. Represent. You're a queen. You're a queen. Oh.
Thank you guys for joining the Q Chat. Today, I have a very important guest. He's been on the show before, and we're going to talk about mental health. Of course, unfortunately, we just had a terrible situation that occurred with Regina King's son committing suicide. So I wanted to go ahead and switch up my schedule, my recording schedule, because mental health is something that is really dear to my heart. So we just wanted to talk about, again, just erasing stigmas in our community, seeking help, and hopefully we can help someone. So my guest today is Dame Dash. He is not your average therapist. And we're just going to go ahead and just, like I said, chop it up. So how are you doing today?
I'm doing great. How about yourself? Thanks for having me.
No, long time no see. Thank you again. Like I said, you're always super gracious when I bug you to talk about, something that's important to both of us, talking about mental health. So of course, like I said, this terrible tragedy, that the world found out about this weekend. I wanted to first just ask you again. I know I feel a stigma regarding mental health. I hate when people use the term crazy, or just, I think sometimes in our community, we're not very educated about anxiety, depression, different disorders. What are just some of the steps, if any, that we can do to make the conversation more common so that we can just erase some of these stigmas in our community?
Right. Absolutely. I totally agree. There's still a stigma associated with mental health. We've came a long way over the past, I would say, maybe decade or so, to where it's more of a mainstream conversation where you got, celebrities involved as far as advocating to reduce the stigma, as well as just a global type of stance in regards to mental health, and more specifically here in the United States, where we struggle often the most, with just societal issues and different cultural backgrounds, and being a melting pot that it is. So just with the different perspectives, I'm glad that it's getting the attention that it definitely deserves, because every single person, has mental health, whether it's good or bad. We all have mental health. We've all been depressed. We've all been anxious at some point in time. We've all been angry. Mental health is not necessarily the absence of those things, but how we cope, how we deal with those things. So just reducing the stigma associated with people who may have moderate to severe type of episodes and ongoing symptoms is one of those things that I'm a huge advocate for.
And thank you so much for just breaking that down, because once again, I just think that's where some of the things stem from, the stigma. Like you broke down, like there's moderate mental health issues. Everyone has mental issues regardless. We all have emotions, so just thank you for breaking that down. Now, of course, with the situation that happened over the weekend, the news that we received over the weekend, what are just some of the stigmas involved in suicide? I think sometimes people still feel like our culture doesn't commit suicide, which obviously is not true. So what are just some of the ways, that we can also just have the conversation in our community regarding suicide? Everyone is going through a lot right now, and it's hard for some of us to just handle these things, that's happening in our world right now. So just how can we just make this conversation more common so that hopefully some people can be more comfortable and just seek help?
Yeah, absolutely. suicide is one of those things it's a very touchy subject for a lot of people. I guess regarding, just the cultural standpoint, from a religious standpoint, there are some implications with that as well. So I guess that's why suicide is really a difficult conversation to have. But on the flip side, I'm not gonna say but on the flip side, we have to be conscious that suicide, especially within, I would say, from 10 to 34, it's a wide range, but it's the second leading cause of death. From early teens all the way to late 30s, that's the second leading cause of death. So it is one of those things that happens very often, and some of them are not even reported, or even not even reporting the attempts. We're talking about actual suicide completions. So it could be even more, the rate could be even higher when we're talking about attempts as well as actual completions of suicide. And one of those stigmas, and one of the things that I've been working on over the past few years, and a lot of mental health professionals and people in this field, is trying to alleviate or eradicate the word commit suicide, because it almost gives a negative connotation to suicide. When you commit someone, that's when they've done something illegally, something wrong, things of that sort. So it kind of shifts the perspective or the outlook on suicide as this huge negative thing. I don't know if it relates to the religious perspective or just how we view death overall. So now we're going from committing suicide to death by suicide. So I think that's one of the hugest landmarks and one of the biggest things that we've been trying to eradicate, I would say over the last 5 years, to say die by suicide versus committing suicide, because it's something that, happens. But every person, or most, I'm not going to say every person, but most people in general who have completed suicide, it wasn't that the fact that they wanted to die. A lot of people just don't want to feel that pain or that anguish that they're suffering from, and that's the way that they choose to kind of end that pain. So oftentimes we have to look at it from that perspective, what they're dealing with, from an emotional level, as well as from their reality, and how they decide to cope with it or not cope with it at all. So just trying to reduce and eradicate that stigma that death in general, or by suicide, has a negative connotation in it, based on our perspective. But from that person's perspective, they just don't want to hurt anymore.
Mm-hmm. Right. This is such a heartbreaking situation. Can you break down suicide ideation? Because I think some people aren't familiar with, ideation, as opposed to, like you said, the actual act of, dying by suicide. I'm glad that you mentioned attempts as well, because sometimes, people attempt suicide and they aren't successful. They receive treatment, but there's so many layers to it that a lot of people aren't aware of.
Right, absolutely. Well, again, like you said, there are different levels to it. Suicidal ideations is just having that thought of, and it could be as something as simple as, what would the world be without me? If I left today, would my family miss me? Or life isn't worth living anymore. Should I stick around? Should I leave? Type of thing. So just having those particular types of thoughts, and not necessarily, it may include a plan as far as, okay, I'm going to take some pills, or I'm going to die by, a self-inflicted gunshot wound or something like that, or jumping off of a building. When we start to move into that particular layer, that's when it's, becoming more concrete, and, they're going past the actual thought, like a wandering thought that kind of goes in and goes out, within a couple of minutes, or situational. A lot of people, for example, like if you go through a really bad breakup or something like that, and it's like, well, if this person doesn't love me, then no one loves me. So why should I be here? That may be a thought, but they don't have an actual plan. Maybe I'll, do something to end my life, because of that. So ideations are really just thoughts. They may be persistent thoughts. They may be thoughts that come in, like I said, within a couple of minutes, then they dissipate over time, and you kind of encourage or implement some type of coping skill to kind of manage that, or it elevates to an actual plan and actually having the means to do that. If you have a plan on taking pills, do you have access to pills? Whether that's Tylenol or anything that you have, in your medicine cabinet. So it is different levels from the thought to the actual means to do it, the actual attempt. And then, after the attempt, did you successfully complete it or not? So it's definitely different levels to it.
Now, I know you mentioned, and I think as far as suicide ideation.
Hey, yo, peace world, it's the Love King of R&B, Raheem Devon, and this is the Q Chat. Keep it locked right here.
Now, I know you mentioned, and I think as far as suicide ideation, a lot of people have had those thoughts, whether they choose to admit it or not, and I know you also just mentioned just some coping skills. What are just some coping skills a person could do? Because especially I feel like right now we're in such an extremely dark time that maybe a person who may not have had any suicide ideation prior to 2020 may have it now. Especially we see death on a daily basis now. And I just think it's just a lot, so some people, they can't handle it, so I think some people have, I would think it's common whether, some people may not want to admit it, that they've thought, well, what would happen if I were no longer here? A lot of people are dealing with so much stress. What are some coping mechanisms, skills a person could use? Let's say they are just dealing with ideation. They may not have a plan. It's not going to it may not get to that point. Who knows? But what are some skills? Because I would assume if you have that ideation a lot, it could eventually, escalate to having a plan and, acting out on it. But what are some coping mechanisms for a person who they're just at the level where they're just having an ideation, but they're having it a lot?
Well, I mean, first and foremost, you definitely have to start at just the basics of just being able to acknowledge those are the thoughts that you're having. A lot of people that have those ideations, and like you said, they may not admit it. It may progress to something, a little bit more deeper as far as the actual action or, having the means to do it. But first and foremost, having the ability to acknowledge that, hey, something is off. I'm not thinking normally. I'm depressed. I'm anxious. I'm a combination of those things. I'm feeling overwhelmed. First acknowledging those emotions that you do have. And secondly, we move into that action phase. What are we going to do about that? Whether that's, talking to a trusted individual, whether that's a family member or a friend, to kind of talk about what's going on, was leading up to these particular thoughts, because everything that we experience in life gives us a thought, which leads to our emotions, and then our emotions lead to our behaviors. So in order to correct the emotions and the thoughts that we're having, we have to go back and think about the experiences that we've had that causes kind of draw these types of conclusions, and opportunities or alternatives to actually address it. So again, first and foremost, acknowledgement. Secondly, doing something about it, whether that's talking to a trusted individual or even a professional, more so the latter. I'm definitely a huge advocate, not just because I'm a therapist, but I think everyone can benefit from therapy, whether that's just life transitioning, growth, where you want to go in life, things like that. It doesn't always have to be mental health related, but just from a growing progress and process, implementing that type of treatment in your life, some type of self-care. And I count mental health treatment as self-care. You're taking care of yourself. So doing those things, but also being aware of where you're at as far as your mind, body, and spirit. All three of those things are connected. So if your mental is off, then that's going to throw everything else off. That's going to throw off your appetite. That's going to throw off your sleeping patterns. That's going to throw off your relationships. That's also going to throw off how you connect with your higher power. So all of those things, it's a trinity for me. It's mind, body, and soul. So when your mental is off, making sure that you're checking in on those other avenues and aspects of your life, and making sure that you're, the best that you can be in those avenues as well.
Now, of course, you touched on something that's important to me as well, going to therapy, and I'm happy that you mentioned it's vital no matter what stage you are in life. I just think, once again, there's a stigma behind therapy, especially in our community. I know a lot of us were raised that, with a religious background, and sometimes people feel like the two don't work together, when they actually could. And in addition, I think sometimes people just associate therapy. Well, if you're going to a therapist, you must be having like this terrible time in your life. Not that there's anything wrong with that, but you also could just go to a therapist just for maintenance. Like I've used the analogy in the past. You're supposed to get your teeth cleaned every 6 months. You're supposed to get physicals, but we never put going to therapy and checking on our mental health in that same routine, to make it more common. So, like I said, that stigma behind therapy, especially in our community, is there. Obviously, I think the conversation it's getting better. There's a lot of celebrities who are very open. They're big advocates for mental health, which is great. But just for the average person, people just still tend to have some level of shame behind therapy. They're afraid. They just think it's not good. They're against it. Just how can we, once again, I think a lot of things can just start with a conversation or just having some education behind it. Where can we start so that we can really normalize going to therapy?
Right. I think one of the first things that we have to start with is the conversations that we have in our home. Whether that's with your significant other, whether that's with your parents, whether that's with your children, being able to have open dialogue about actually how you're feeling. We go throughout our day, and we pass by people, we say hello to people all the time. That's usually a combination. Hey, how you doing? But we honestly don't. We're not too forthcoming as to actually how we're doing. We often say we're fine, and we could be totally down in the dumps. So making sure that we're making it a regular practice and a routine to check in with each other. Like I have on my shirt here, check on your strong friend. Check on people. Check in and see how everyone is doing. Have those conversations, breaking it down to the basics. We're used to social media. We're used to sending DMs and text messages, but not actually hearing the person or seeing them face to face. We used to have a time, when I was growing up, people just stop by your house. If they haven't heard from you in a while, they'll stop by the house and just check in on you. So something as simple as laying eyes on someone and actually asking them how they're doing and actually meaning it, goes a long way. There have been a lot of situations over the years, and I've been in this field, well over 15 years now, to where just seeing that person help minimize, some of their mental health symptoms. They were depressed prior to seeing me, and you never know that light that you have could be blessing somebody else. It can influence their emotions just by you asking them how their day is going, or actually showing genuine concern and empathy for what they're dealing with. So I think breaking it down to that simplest form, parents being able to have those conversations with your children as far as their emotions, their willingness to be open, transparent, vulnerable, but you also have to be that role model for your children as well. Being able to be transparent and vulnerable. If you're stressed, if you're feeling overwhelmed, being able to have those conversations with your partner, with your best friends, with a trusted individual, so you don't feel like you have to keep it all in and be that strong person, that strong Black woman, that strong Black man, or that strong person in general. I'm just not going to put it on Blacks, right, as a collective, but we're the group that always want to be quote unquote strong. And
Right.
that doesn't necessarily mean that you're not absent, of emotion. We all have emotions, but being strong in our sense means that we're going to be able to withstand everything that life throws at us, and we not budge or we not break down.
Right.
Even the strongest person has that breaking point, that boiling point. And,
Right.
and oftentimes we wait too late to react or be proactive in those things because we feel like we got it, we're strong enough, we can handle it until it's a little bit too late. So making sure that this is a regular routine, being able to check in with your family, being able to check in with your friends goes a really long way.
Oh, yeah. Now, let's say, for example, and I agree, just checking on someone makes a huge difference. So let's say, though, there's a situation where a person, well, I guess it's a two-part question.
Okay.
One is just what are some things we can maybe make note of, in our loved ones, because sometimes there are signs that people may not notice until after something bad has
Right.
happened. Like sometimes people they leave breadcrumbs just
Mhm.
in a change in their behavior, their mood. What are some things we can look out for? And then the second part of the question is, let's say you have noticed something with your friend or your loved one, but you're uncomfortable or maybe even afraid to talk to them because you may not want to offend them or you're not sure how they're going to react.
Mhm.
What's a way to maybe kind of start the conversation, or what's the best way to approach that person in a kind way,
First part, some of the signs that you would see, and like you said, there are behavioral changes for the most part, with someone who's experiencing maybe a depressive episode, to where that could lead potentially to suicide. You would probably notice a behavioral change, things that they used to be involved in, are interested in, they're no longer doing those things. They may sleep too much. Every time you talk to them, they're either asleep or they just finished napping or something like that. They're sleeping too much or they're not sleeping at all. It is one or the two. It's not a normal 6 to 8 hour, type of thing. It's okay, I'm sleeping all day, or I've been up all night, I haven't slept in 48 hours type of thing, because their mind is just racing that much that they, have insomnia. That can be a big one. Maybe start, if someone, let's just say you love shoes, right? And you start giving your shoes away to like your friends and to your family, like, hey, you can have these shoes. Like, these are my favorite ones. You can have them. When you notice small things like that, that should raise an eyebrow as well. Some people stop eating. Some people often kind of like starve themselves, just to kind of, I guess they're battling that. I'm not exactly sure what it is, but they may stop eating or they may overeat. Um, Things like that, just to be wary of. If they're not motivated at work anymore, they're feeling like they're giving up. They're not motivated to, conduct daily hygiene. Things like that is just that we normally don't really think about. If their school performance, decreases significantly, if they were A students and all of a sudden, they're flunking out of school, those are some telltale signs that something is going on. So once we recognize those signs, and being conscious of those things and being intentional, then being able to have those uncomfortable conversations. You got to be comfortable with being uncomfortable, right? Until it becomes a norm. Having those conversations about what you're seeing from your perspective. I would rather someone be pissed off at me for bringing up a conversation, versus them being dead. Me walking in and finding them dead because we didn't have that conversation, because they felt like they were alone. And a lot of people who struggle with depression, loss, even grief, when we're talking about grief of a child, losing a child or a loved one to suicide, they feel like they're alone in that fight. So being able to, again, have those conversations and making them feel They're not alone. There are other people who are struggling just like them. Whether that be in a support group form, whether that comes with family, or whether that comes with them seeing an individual therapist, a family therapist, how the family could help them cope with the mental health disorders or illnesses that they're dealing with. But be uncomfortable, because with uncomfortability it becomes growth. You grow from that. You have those conversations, those difficult conversations. They may be upset in that moment, but long term, they're going to thank you for at least checking in and having that conversation, in the long run, because they'll still be here. And as long as you're here, if there's a problem, there's always a solution. Outside of suicide, there's always a solution. So being able to bring it to them like, hey, like I've noticed that, hey, you recently quit your job. You love that job, or you're no longer playing basketball with us. Like, what's going on? Like, you're staying in the house, you're secluding yourself, you're isolating yourself. You lost a lot of weight. And it's not because you were trying to lose weight, you just wasn't eating. So all of these different things, it may spark a flame. It may start that fire for that person to get the treatment that they felt like they were afraid to get because of the stigma that's associated with mental health. So as long as you can spark that fire, I'm okay with being the bad person. You can paint me the bad person all day, but if you're alive, at least we can work on that relationship. We can communicate, hey, like, why did you feel that way? Or, this was my intention by bringing this up.
Right. Very good analogies. So one thing I want to ask you as well, like I said, some people who not very aware of the benefits of therapy. They're afraid. I've just heard some people like they'll try therapy and like, well, I didn't like it. And I'm like, well, what type of therapist did you choose? I think some people don't understand, like, why would you choose someone that you're not even comfortable talking to? Like, I just think sometimes are their own worst enemies. So what are some things, for a person who is unfamiliar with the benefits of therapy, but they are ready to take the first step to seek therapy? What are some of the things that they can look for in finding a therapist? Because I think a lot of people have this idea of a therapist as a stuffy white man in a tweed blazer and a pipe, with a little English setter dog, like, and that's not, that's not it, so what can they look for just to understand, hey, that you can be comfortable,
Absolutely. We've definitely transitioned from that Mr. Rogers look and, that crossing the legs, and we got a pad in our hand and we may have a pipe in our hand too and just talking. We're far away from that, but you definitely hit the nail on the head. Definitely find someone that you're comfortable with talking to. And I get that a lot. I get that a lot with the clients that I serve, that I see on a regular basis. They seek me out, and oftentimes they may just be scrolling down a whole bunch of therapists online. So, for example, going to like Psychology Today, that's one of the websites where we house a lot of therapists in your area, and you can actually do a filter if you want a female, if you want a Black female, if you want a male, if you want a Black male, Caucasian, whatever the case may be, and whatever their specialty is, or what your reason for therapy is. It filters out all the different therapists and brings you down to something that you can kind of choose from. So a lot of people say, man, like, I reached out to you because you look pretty cool. I'm like, okay, I'm just being me. I'm going to be comfortable. I dress down. I hardly ever dress up. You probably never see me in a suit in my office. Now, if I would, but I'm comfortable because I want the client to be comfortable. If I look like a prude and I'm acting like a prude and I got my nose stuck, up in the air like I'm.
Vivian finds herself in a life or death situation with two undercover drug enforcement agents. These guys are as crooked as they are dangerous.
Marcus wants to control her and use her only for sex. Lenny, on the other hand, he just wants her dead. The only way to escape their grasp and the constant threat of death is to play by their rules. Vivian discovers the lure of danger combined with the fascination of sexual evolution to be exciting. She falls in love with a monster. That leads her to become entangled in a relationship filled with manipulation and obsession.
And like a prude, and I got my nose stuck, up in the
Yeah.
air like I'm better than that person, then they're not going to be transparent and vulnerable with me. So
Right.
being able to find someone, and it's just like any other relationship, you get into some relationships and sometimes it just don't work, and you have to be able to accept that. You try a therapist and it may not work. They may be more aggressive or assertive in telling you what you need to do versus allowing you to reflect and allowing you to make the decisions what's best for you. Some people like that directive type of therapy. No, you need to do this, you need to do that type of thing. Whereas some people don't like to be told what to do. Like, give them options, give them different perspectives to look at the situation and allow them to make the decision for themselves, like what works best for them. Because at the end of the day, even as a client, you're the expert of yourself.
Right.
I'm just the expert in the educational part of it. I got my license and got my master's and all those things, but I don't know you. You know yourself better than anyone. So you know what works for you and you know what doesn't work for you. And I'm just here to give you different perspectives on how looking at that. So definitely don't be discouraged if you went to therapy before when you was a teenager and you hated it, and now you're an adult and you're still kind of skeptical. Still try it out. Try it out. If you're more comfortable with speaking with a woman, find you a woman. Maybe a younger woman, maybe an older woman, maybe a middle-aged Black man, whatever the case may be. You can actually customize the type of therapist that you want. You can go therapist hunting. If it's not working for you, you can tell that therapist, hey, I don't feel like this is working for me. Either I'm not being vulnerable enough or I don't feel comfortable being vulnerable with you for whatever reason. And that's okay.
Right.
But once you find that perfect one, you'll feel it, just like I said, in any other type of relationship, romantic relationship, friendship, whatever. When you kind of click, it works. So the same way you have to develop a rapport in a personal relationship, you have to develop that rapport in a professional relationship as well. Just because I'm a therapist don't mean I don't have, personality and things like that and different attributes that you may connect with or that you may not connect with. Just like I have certain biases and, things that I'm not willing to do. I'm not willing to see a pedophile. I know that about myself.
Right.
So know what your limits are, know what your boundaries are, and allow that to be your motivational force to find the therapist that you need for you.
Right. And I'm glad you related it like that, because I just think, people just don't understand the importance of it. Like, it's very vital who your therapist is. So make sure it's someone you're comfortable with, and you're not obligated to continue anything with someone you don't like. But just in any case where you may have a therapist that didn't click, just don't stop there. So I'm happy that, you broke it down like that. So the next thing is, some people may think, oh, I can't afford therapy. So can you just break down the resources? Because there's some therapists that have sliding scales. I just think sometimes people may be discouraged saying, hey, I don't have health insurance. I can't afford that. I can't pay anybody to talk to them. So what are some of the resources as well out there for people?
Right. And that's definitely a real barrier for a lot of people. During this pandemic, it definitely taught us as therapists, some valuable lessons. for sure. Being able to reduce those barriers, whether that be transportation or from the financial aspect. A lot of organizations provide scholarship opportunities, like you said, sliding scales opportunities as well. A lot of people that have insurance, they have high deductibles and high copays, and although you have insurance doesn't mean that you can necessarily afford it. So being able to understand what your boundaries are financially, but also don't allow the financial part to be a barrier for you seeking treatment. I tell my clients all the time, if you can't avoid a session, I don't want you to go months without a session because you feel like you can't avoid it. We'll worry about the money part later. You want to make sure that your mental health is up to par. But going back to just resources, definitely if you are working, most jobs, if you have benefits, they have a EAP program, an employee assistance program, where you're able to get, sometimes it's 8 to 10 free sessions, nothing out of pocket. You get those sessions, and if more is needed, then we'll just send justification as to why you still need it. So there are definitely opportunities for growth. There are a lot of, like we were talking about with celebrities and things like that. There are a lot of celebrities and people with big names that actually have platforms for mental health to provide scholarship opportunities. If you can't afford, you just apply, and you get free sessions in your area. I know Taraji P. Henson does that. We've done some work here in this area with her. Charlamagne the God, he has one as well. Among a lot of different people. That's why I know I'm missing a lot of people, but those are the two that just popped off in my head. So do not utilize lack of finances or financial strain to not allow you to get the treatment that you need. If you broke your leg, I'm pretty sure you're gonna go to the emergency room.
Right.
Get that fixed. So if something is wrong with the mental, make sure you reach out, because if you don't ask the question, nobody's gonna tell you, especially as far as scholarships and things like that. But definitely sliding scales, EAP programs, as well as just national mental health advocacy programs that are available out here. But I would definitely start at like NAMI. That's one of the national organizations for mental illness. Definitely you can start there in your area, there in every state. So make sure you check with them as well. And when you reach out to different therapists, just ask them, like, what do they offer? And you can say up front, hey, the finances is pretty tight. Do you offer anything to assist with that?
So before we end everything, and once again, like I said, thank you so much for just being so gracious and always supporting the platform. This is such an important conversation, much needed. Just how would you just like to just end everything? Like I said, this was just a rough weekend, I just feel just with everything going on, when you just hear someone, whether you know them or not, when you just hear someone just lost their life, it's a sad, heartbreaking thing, because I think all of us have gone through like the mental health Olympics, like we've been tested greatly. So it's just a great level of sadness, when you hear someone, is taking their life, or, even this times in the past, we've heard people attempted suicide. It hurts, because it's such a collective feeling. So how would you just like to summarize everything for people who just to make sense of everything, we're all trying to figure this out, and like I said, mental health is an important conversation. And I just, if I could have a wand, I would just wish that we could lift the stigma behind this and just be more comfortable talking about this.
Right, absolutely. That's the biggest thing. Continue to reduce the stigma. Everyone has mental health, just like we have physical health. Some are more detrimental than others. It's just the thing with mental health, is something that you can't see. Like I mentioned, a broken leg. You can see that I have a broken leg, but you can't see that I have a broken mind or a broken heart, or I'm struggling with depression or anxiety, or I'm hearing voices. These are things that you can't really quantify. You can't see it, with the naked eye. So just because you can't see it doesn't mean that it's not there. So being able to just, acknowledge those things, communicate, let's talk about it, continue to talk about it. Everybody has it. It's almost like COVID. Everybody either have it or had it at least one time. So it's the same thing. It's kind of an inside joke a little bit. But at some point in time, you're going to feel one of those four. You're going to be happy, mad, sad, or fearful. One out of four every day. It just depends on what you do with it. Once you acknowledge what that emotion is, what do you do about it? And mental health is sometimes it feels like it's a personal journey. It is self-discovery, it's self-awareness, it's being intentional, but it also allows you to form a support group, family, friends, your community. Utilize those people as a network to make sure that you get the resources and the things that you need in order for you to maintain your own mental health, but also do things for yourself every day. I tell my clients to do something for themselves every day, whether that's rubbing yourself a bubble bath, going to get you some ice cream, going to your favorite restaurant, or turn on your favorite song. Anything that's going to lift your spirits. Do something for yourself every day.
Thank you again. Like I said, it's just, I don't know, like I said, it's just a hard time right now for everyone. So, it's naturally heartbreaking when we hear sad news like this. So tell everybody how they can follow you on social media, how they can reach out. Who knows, somebody may have some questions. They want to, reach out to you directly. One other thing I think is important, I'm real big on just for our community seeing a Black male therapist. I personally have a Black male therapist. So I just think it's important, especially just seeing our brothers in roles that just break stigmas alone is always a plus. So just tell everybody how they can find you.
Yeah, you can find me on my website, Dameon Harmon, government name, DameonHarmon.com. You can find me on Instagram, natural_average_therapist, Facebook, Dameon Harmon. That's my business page as well. Twitter, I think is Not Your Average Therapist. All these different social media platforms. If you just Google me, all of them should show up there. A whole list of them. So, but DameonHarmon.com is probably the first place to start. If you got any questions, if you need to reach out to me for, therapy sessions or speaking engagements, anything like that, podcasting, I still have the Couch 704, and I have a second one, Blow the Whistle podcast as well. Everything mental health. We talk about mental health. So we're reducing it one day at a time because we talk about it all day, every day.
Yes. Thank you. And I salute you, like I said, because your profession is extremely important. So I definitely appreciate you and just thank you just for doing something extremely important to help people. Because this is just, like I said, it's definitely an important tool, topic, everything. So just thank you again. And thank you for this conversation. And for everyone that tunes in, it is okay to not be okay. You matter. We need you here. So whatever it takes, just to feel whole, to be happy, to have a peace of mind, just don't let anyone reduce you or make you think that you're doing something wrong just to take care of yourself. Your mental health is extremely important. We got to check our hearts, our minds, our bodies. This is super important. So thank you guys. And like I said, if you need someone to talk to, just reach out to someone, please. Just like I said, just don't feel that you have to go through things alone. So thank you guys for joining this conversation and be safe and go love yourself.
Thank you.
That must have did this beat.